The adult human skeleton consists of 206 bones which are grouped into the axial and appendicular skeletons. The axial skeleton consists of the skull, vertebrae, and thoracic cage, sternum, and ribs. In this lecture, we will concentrate on the human skull. Just like the body, the skeleton is divided into two main subdivisions. The axial skeleton contains the bones that are in line with the main axis or center of the body. The appendicular skeleton consists of the bones of the appendage's upper and lower extremities and the bones that connect the extremities to the axial skeleton, called girdles. This picture shows the bones of the axial skeleton in orange and those of the appendicular skeleton in yellow. Altogether, there are 80 bones that make up the axial skeleton. These include the 22 bones that comprise the skull, 6 ear bones or auditory ossicles, 3 per ear, 1 hyoid bone, which does not have a direct articulation with any other bone, 24 ribs, 1 sternum, and 26 vertebrae. The human skull is extremely complex because of its three-dimensional nature. The pictures in the textbook and lab manual can only show one view at a time: anterior, lateral, superior, inferior, and so it is hard to get an understanding of how all the bones fit together to make up the skull. I suggest watching the Mediasite video on the human skull and visiting BIOL at masteringit.com to get a better feel of how the skull is put together. The 22 bones comprising the skull fall into two categories: cranial bones and facial bones. There are 8 cranial bones, which include 1 frontal, 2 parietal, 2 temporal, 1 occipital, 1 sphenoid, and 1 ethmoid bone. The skull cap, or calvarium, is made up of the frontal, parietal, and temporal bones. These bones and the occipital bone are connected to each other via sutures. There are 14 facial bones, 2 maxillary, 2 palatine, 2 nasal, 2 inferior conchae, 2 zygomatic, 2 lacrimal, and 1 mandible, and 1 vomer. Other bones that are associated with the SK all include the auditory ossicles and the hyoid bone. The auditory ossicles are found within the temporal bone, and the hyoid bone is connected to the skull by muscles. The following slides show different views of the skull. Try to find each colored bone in all 4 views. This picture shows an anterior view of the skull. Here's a lateral view which also shows 3 of the 4 sutures. Your goal is to learn all the bones of the skull in all views. This slide shows a posterior view of the skull on the left and a superior view on the right. In the superior view, you can see the sagittal suture and part of the lambdoid suture as well. From an inferior view, you can see some openings in the skull through which arteries, veins, and nerves pass to get into or out of the skull. This is a sagittal section through the skull. Keep in mind how different each bone looks in a different view. In this view, we can see some of the paranasal sinuses that will be discussed later, and some of the internal markings on the interior surface of the parietal bone. In this view, the calvarium has been removed by making a horizontal or transverse section through the skull. We are peering down into the skull floor. Again, we can see a number of foramina through which nerves and blood vessels pass. The word suture means seam, so you can think of sutures as a seam sewn between bones. In fact, sutures are immovable joints found between certain bones of the skull. The articulating edges of sutures are serrated, and the interdigitations are held together with fibrous connective tissue. There are 4 sutures in the adult skull. The coronal equal crown suture is between frontal bone and the 2 parietal bones. The sagittal suture cannot be seen in this lateral view of the skull, but is located between the 2 parietal bones. Only part of the lambdoid suture is visible. The lambdoid suture, named after the Greek letter lambda, is located between the parietal bones and the occipital bone. The squamosal sutures are between the parietal bones and the temporal bones on each side of the skull. From a superior view of the skull, the coronal, sagittal, and part of the lambdoid sutures are visible. The articulation site between the bones is outlined in yellow. Sutures are formed between 2 to 24 months after birth by intramembranous ossification. At birth, the bones have not completely formed and there are soft spots called fontanelles between the bones. Fontanelles make the skull more pliable and allow for rapid growth of the brain during infancy. There are 4 fontanelles. The anterior or frontal fontanelle is between the frontal and parietal bones. The posterior or occipital fontanelle is located between the parietal and occipital bones. The anterolateral or sphenoid fontanelle is outlined by the frontal, parietal, temporal, and sphenoid bones, and the posterolateral or mastoid fontanelle is between the parietal, occipital, temporal bones. This slide shows a superior view of a fetal skull. Notice the pointed areas on the skull bones. These are primary ossification sites. Notice the frontal suture. This suture is not present after birth. The frontal bone in adults is usually one smooth and solid bone, but in fetal life, there are 2 frontal bones that fuse along the midline before birth. The frontal bone comprises the forehead and roof of the orbit. As stated previously, the fetal frontal bones fuse during development but usually do not form a suture. However, in a small percentage of the population, there is a remnant of the frontal suture called the metopic suture. Some other features of the frontal bone include the supraorbital foramen through which the supraorbital nerve and artery pass. From the inferior orbital surface, there is a shallow depression in the frontal bone called the lacrimal fossa. It houses the lacrimal or tear gland. The secretions of the lacrimal gland wash over the surface of the eye diagonally and are collected in the lacrimal sac located inferiorly and medially in the orbit. More on this later. Also visible is the frontal sinus, which is lined with mucous membrane and contains air. Sinuses in general help to make cranium lighter and are important for sound resonation and hearing. The paired parietal bones pares equal wall make up the sides and roof of cranium. They fuse with each other in the midline forming the sagittal suture. Occasionally, wormian or sutural bones are present. The superior and inferior temporal lines are attachment sites for the temporalis muscle, which inserts on the mandible and functions to elevate the lower jaw. The insert on the lower right is a drawing of some of the features found on the inside of the parietal bones. There are obvious grooves running on the inside of the bones. These are the impressions of the vessels that supply the outer brain covering called the dura mater. The occipital bone makes up the back of the head and most of the base of the cranium. It has 4 main features. The foramen magnum, which literally means big hole, the occipital condyles, the external occipital protuberance, and the superior and inferior nuchal lines, 2 curved ridges of bone lying above and below the external occipital protuberance. From inferior view, the most obvious feature of the occipital bone is the large foramen magnum. This is the site where the spinal cord joins with the inferior-most part of the brainstem called the medulla oblongata. On the inner aspect of the foramen magnum, 2 smaller foramina are visible. These are the hypoglossal canals through which cranial nerves the hypoglossal nerves pass to get to the muscles of the tongue which they control. In addition, it is through the foramen magnum that the vertebral arteries gain access to the base of the brain. They assist the internal carotid arteries in providing the blood supply to the brain. On either side of the foramen magnum are the occipital condyles. These articulate with the first cervical vertebra, called the atlas, and allow the skull to rock back and forth, making the yes motion. The small pits in the bone are for small blood vessels, such as nutrient arteries. Just superior to the foramen magnum is the medially located extern, occipital protuberance, which can be easily palpated. It is the big bump on the back of the skull. It is the insertion site for the ligamentum nuchae, a large, fibrous, elastic ligament that extends down to the 7th cervical vertebra. It helps to support the weight of the head and stabilize the neck. The superior and inferior nuchal lines are two prominent ridges which are attachment sites for muscles that move the head. The temporal bones make up the lower sides and part of the floor of the skull. There are several prominent features exhibited by these bones. The temporal squama are the thin, flat plates on the sides of the cranium. These are easily fractured if one receives a blow to the side of the head. The temporal lobe of the brain sits just inside the temporal squama. The temporal lobe is involved with certain qualities of memory, so an injury to the side of the head may result in different degrees of amnesia. The zygomatic process is a bar of bone that articulates with the temporal process of the zygomatic bone to form the zygomatic arch or cheekbone. The thick, bumpy, and irregular part of the temporal bone is called the petrous portion. Petrous means rock. It is the same word from which we get petrified in the name Peter. The petrous part of the temporal contains the external auditory acoustic meatus, which channels sound waves to the eardrum. Internally, it contains the middle and inner ear, which are used for hearing and balance. The mastoid process is an important attachment site for muscles that flex and rotate the head. From the base of the skull shown in the upper left-hand corner, the carotid canal red arrow and the jugular foramen are visible. The internal carotid artery enters the skull to supply the brain via the carotid canal. The jugular foramen serves as an entrance and exit point for cranial nerves IX, X, and XII, and the internal jugular vein. As mentioned previously, the mastoid process serves as the attachment site of several muscles that function to move the head. Internally, the mastoid process contains air cells that are lined with a thin epithelial membrane. Their normal function is to play a role in proper acoustics. However, occasionally the membrane can become infected. The resulting inflammation is referred to as mastoiditis. Mastoiditis can be serious because infections of the throat can spread to the ear cells and onto the inner ear and brain. Just posterior to the mastoid process is a sharp, pointed projection called the styloid process. It is an important attachment site for muscles that raise the hyoid bone for swallowing and retract the tongue. Between the mastoid and styloid processes on the base of the skull is a small foramen called the stylomastoid foramen. It transmits cranial nerve 7 and the stylomastoid artery. The internal acoustic meatus is visible on the inside of the temporal bone. The blue arrow in the photograph on the right is pointing to this opening. Through it passes cranial nerves 7 and 8, the facial and vestibulocochlear nerves. The facial nerve is motor to the muscles of facial expression and carries taste fibers from the anterior 2/3 of the tongue. The vestibulocochlear nerve brings information on balance and hearing to the brain from the inner ear. The diagram on the left shows a coronal section through this area. The temporal bone houses the middle and inner ear chambers within the thick petrous part of the bone. Clinically speaking, the articulation point between the mandible and the temporal bone is very important. This joint is called the temporomandibular joint, or TMJ. The joint is formed between the mandibular fossa and articular tubercle of the temporal bone and the condylar process of the mandible. Many people suffer from some aspect to TMJ syndrome. Symptoms include pain around the ear, sore jaw muscles, abnormal wearing of teeth, inability to open mouth all the way, and clicking and popping when opening and closing mouth. In severe cases, hearing loss can result due to excessive wearing down of the mandibular fossa and the proximity of the joint to the external auditory meatus and middle ear chamber. Some of the causes of TMJ syndrome include grinding the teeth when sleeping, clenching jaw, and arthritis. The sphenoid bone is known as the keystone of the cranial floor because it articulates with all the other bones of the cranium. It makes up the floor of cranium in the middle part of the base of the skull. When removed from the skull, the sphenoid resembles a bat or a bird. There are numerous important bony features and foramina in this bone. The sphenoid is comprised of greater and lesser wings in a body. The superior surface of the body is visible when you are looking down into the skull. It has a saddle-shaped structure called the sella turcica or Turkish saddle. The seat of the saddle contains a depression called the hypophyseal fossa, which cradles the pituitary gland. The greater wings project laterally, forming parts of the middle cranial fossa, dorsal walls of the orbits, and external wall of the skull. The lesser wings form a ridge of bone anterior and superior to the greater wings, and form part of the floor of the anterior cranial fossa, and part of the medial walls of the orbits. The pterygoid processes make up the inferior part of sphenoid, and serve as attachment sites for some of the muscles that move the mandible. The body of sphenoid contains the sphenoidal sinuses that help to make the skull lighter. They are lined with mucous membrane and drain into the nasal cavity. The optic foramina or canals are located between the body and lesser wing, and transmit cranial nerve to optic nerve and the ophthalmic artery. The superior orbital fissure lies between the greater and lesser wings and forms a large and triangular-shaped slit which can be seen in the back of the orbit. The superior orbital fissure transmits cranial nerves 3 equal oculomotor, 4 equal trochlear, the ophthalmic branch of V equal trigeminal, and 6 equal abducens. The foramen rotundum and foramen ovale provide passageways for the maxillary and mandibular branches of cranial nerve V, respectively. The tiny foramen spinosum transmits the middle meningeal vessels. The foramen lacerum is located between the sphenoid and petrous portion of the temporal bone and transmits a branch of the ascending pharyngeal artery. The ethmoid bone gets its name from ethmos, which means sieve. It is a fragile and lightweight bone and contains between 3 to 18 air spaces in its lateral masses or labyrinths. Collectively, the air spaces are referred to as the ethmoidal sinuses. The ethmoid bone is located between the orbits and helps to form the anterior part of the cranial floor, medial wall of the orbits, superior part of the nasal septum, and the side walls and roof of the nasal cavity. The ethmoid bone contains the superior and middle nasal conchae, which are two thin, scroll-like processes making up the lateral walls of the nasal cavity. They get their name from a conch shell because internally they are coiled like a snail shell. The cribriform plate forms the roof of the nasal cavity. Cribriform means perforated. The perforations are the olfactory foramina, which transmit bundles of axons called phyla olfactoria from the olfactory epithelium in the upper nasal cavity to the olfactory lobe of the brain, which lies immediately on the other side of the cribriform plate. Separating the cribriform plates is a projection called the crista galli or coxcomb. It is an attachment site for the meninges that cover the brain. The perpendicular plate of the ethmoid forms the superior part of the bony nasal septum. A facial bone called the vomer forms the lower part. Altogether, the bones of the cranial floor form 3 distinct cranial fossae. One anterior cranial fossa is made up of the frontal bone, cribriform plate of ethmoid, lesser wings, and part of the body of sphenoid. It houses the frontal lobes of the brain. 2. The middle cranial fossa includes the body and wings of sphenoid, the squamous part of temporal bones, and the parietal bones. It houses the temporal lobes of brain. 3. The posterior cranial fossa is made up of the occipital bone, petrous, and mastoid parts of temporal bone. It contains the cerebellum, pons, and medulla oblongata of the brain. The bones of the face are irregular in shape. The facial bones include the maxillae, nasal, palatine, zygomatic, vomer, lacrimal bones, and the inferior nasal conchae. Maxilla comes from a word that means to chew. Interestingly, the maxilla articulates with all the facial bones except the mandible lower jaw bone. The maxilla contains 2 large maxillary sinuses, which are lined with mucous membrane. The sinuses normally empty into the nasal cavity. The alveolar process of the maxilla contains the sockets for the teeth. The maxilla begins development as two bones which fuse to form a single upper jaw bone. Looking at the maxilla from an inferior view, the palatine processes can be seen making up the anterior of the hard palate. The horizontal plate of the palatine bone makes up the remainder. The palatine processes of the maxilla unite during the 10th-12th week of gestation. Failure of the palatine processes to fuse during development results in a cleft palate. Immediately posterior to the incisor teeth lies the incisive foramen. This opening transmits branches of the greater palatine vessels and nasopalatine nerve. This is a picture of the lateral view of the maxilla. Notice the anterior nasal spine, the alveola. R process and the zygomatic process of the maxilla. Zygoma means cheekbone, and so the zygomatic bones comprise the cheeks. They also form the lateral wall and floor of each orbit. The zygomatic bones articulate with the frontal, maxillary, sphenoid, and temporal bones. The temporal process of the zygomatic bone projects posteriorly and articulates with the zygomatic process of the temporal bone, forming the zygomatic arch. Zygomaticofacial foramen transmits the zygomaticofacial nerve and vessels. Mandible comes from another word, mander, which also means to chew. The mandible is the lower jaw bone. It is the largest, heaviest, and strongest of the facial ones. The mandible is the only movable bone in the skull except for the auditory ossicles. The main parts of the mandible include the body, angle, and ramus. The mandibular symphysis is the medial fusion point of the mandibular bones. The condylar process articulates with the temporal bone at the mandibular fossa. The mandibular condyle is an insertion site for the temporalis muscle, which elevates the jaw. As seen with the maxilla, the mandible also contains an alveolar process for the sockets of the teeth. The mandibular foramina permit the passage of the inferior alveolar nerves as they course to the roots of the teeth. The dentist injects anesthetic to numb this nerve, which leads into the mandibular canal. The mental foramina allow blood vessels and nerves to pass to the chin and lower lip. The nasal bones are two little bones that form the bridge of the nose. Most of the nose consists of cartilage. The lacrimal bones are very thin and are the smallest bones of the face. They are located posterior and lateral to the nasal bones and help to form the medial wall of each orbit. A small depression in these bones is where the lacrimal sac sits. It functions to collect and help drain tears into the nasal cavity. The lacrimal foramen leads to the nasolacrimal or tear duct. The palatine bones are L-shaped and make up the posterior part of the hard palate, part of the floor and lateral wall of the nasal cavity, and a tiny part of the orbits. Most of the palatine bone is not visible from an external view. The median palatine suture is where the horizontal plates of the palatine bones fuse during development. The inferior nasal conchae form part of the lateral walls of the nasal cavity. They are separate from the superior and middle nasal conchae of the ethmoid. They are scroll-like turbinate bones which in life are lined with respiratory epithelium and contain large venous plexuses. These structures serve to cause air turbulence, which gives the mucous membrane covering the bones a chance to filter, warm or cool the air, and humidify it before it passes to the delicate respiratory surfaces in the lungs. Vomer comes from a word that means plowshare because it looks like the blade that was drawn behind horses or mules to make furrows for planting crops. The vomer forms the posterior and inferior part of the bony nasal septum, and it articulates with the septal cartilage. Together the vomer and the perpendicular plate of the ethmoid make the bony part of the nasal septum. A deviated septum results when the bone and septal cartilage get separated such that the nasal septum is deflected towards one side or the other. Makes for loud snoring. Collectively, several cranial and facial bones and their sinuses form the nasal cavity, sometimes referred to as the nasal complex because of the interrelatedness of the structures to form a functional unit. The nasal cavity is constructed of bone and cartilage. The roof of the nasal cavity is formed by the cribriform plates of the ethmoid. The lateral walls are shaped by the superior and middle conchae of the ethmoid bone, and the perpendicular plates of the palatine bones and inferior nasal conchae. The depressions under each concha is called a meatus. The scroll-shaped conchae increase the turbulence of air flowing through the nasal cavity, which puts more of the inhaled air in contact with the warm, damp mucosa lining the conchae, and aids in trapping airborne debris in the mucus secreted by glands in the submucosa, as well as the goblet cells of the respiratory epithelium. The coronal section on the right-hand side of the above figure shows the coiled appearance of the conch, and the relationship of the sinuses, nasal septum, and the bony palate of the roof of the oral cavity. You should also know what bones of the skull contain sinuses. Collectively, all the sinuses are referred to as the paranasal sinuses, para equal beside or next to. So these are air-filled cavities next to the nasal cavity. The bones that contain sinuses are the frontal, sphenoid, ethmoid, and maxillary bones. As stated before, sinuses lighten the skull and are important for sound resonance when speaking or singling, because the sinuses are lined with mucous membranes that are continuous with the lining of the nasal cavity. Therefore, infections and inflammation causes a pressure when the mucous membranes swell and mucus drainage into the nasal cavity is blocked. This condition is called sinusitis. Symptoms include headaches as well as a stuffy nose.